Welcome to part 2 of this series. We are focusing on distinguishing between disorders with the schizo prefix. We already discussed the personality disorders, so now let's focus on differentiating the psychotic disorders. Schizophrenia, schizophreniform, and schizoaffective have psychotic features. During this video, we will discuss commonly tested overlapping features and also do a short quiz to test your knowledge at the end of this video. It's not only important to know the symptoms of these psychotic disorders, such as positive symptoms and negative symptoms, but to also know when the symptoms started. DSM-5 categorizes a lot of disorders based on timing of the symptoms. So this is a crucial way of differentiating the disorders. The other high-yield way is the timing of the symptoms. For example, if a patient only has psychotic features when they are depressed and their baseline disorder is depression, then this patient has major depressive disorder with psychotic features. I created timelines to simplify these concepts and to make them easier to remember and to understand. Here is a timeline of some psychotic disorders patients can experience. If a patient experiences psychotic symptoms at less than 1 month, then this patient may have brief psychotic disorder. However, if a patient has a psychotic disorder for more than 1 month, but less than 6 months, then this is schizophreniform. Its symptoms are similar to schizophrenia, but the key defining feature is the timing of the symptoms. On the other hand, if a patient has a psychotic disorder for greater than 6 months, then this is schizophrenia. This is very high yield. So pause the video and memorize this, because knowing timelines like this for your exam is very high yield. An easy way to remember the times is with their names. Brief psychotic disorder should let you know it's less than 1 month. The form in schizophreniform kind of sounds like the number 4, which is less than 6 but greater than 1. So that lets you know the timing of the symptoms for schizophreniform. The form in schizophreniform can also be a hint that the patient may be forming schizophrenia, but not quite there yet. This is another way of remembering so you don't confuse it with the other schizo disorders. The schiz in schizophrenia kind of sounds like 6, so schizophrenia. That lets you know that patients need to be experiencing psychotic symptoms for greater than 6 months. Now let's move on to schizoaffective disorder. This can be divided into 2 types: depressed or bipolar. Now let's look at a simplified way of classifying different disorders with psychotic features. In this patient, their baseline is psychosis, as it is always present. However, mania only occurs when there is psychosis. So this is schizoaffective disorder bipolar type. This and every slide from this point is extremely high yield, so take your time and understand and memorize it. Now, in this patient, their baseline is psychosis. Again, it's always present. However, depression only occurs when there is psychosis. So this is schizoaffective disorder depressed type. If you like these timelines, click the like button and subscribe so you don't miss any of these videos. In this patient, their baseline is mania, as it is always present. However, psychosis is only present when there is mania. So this is bipolar disorder with psychotic features. In this patient, their baseline is depression, as it is always present. However, psychosis only occurs when there is depression. So this is major depressive disorder with psychotic features. Now let's take a closer look at the last question from the quiz in part 1 of this series. A 24-year-old male is brought to the ED by his dad because he has slept for 3 hours for 1 week trying to unlock the world's secrets. The patient says he feels terrific and he is seen responding to stimuli that is not there. He has been hospitalized 4 times for these symptoms over the past 2 years. When he is not in the hospital, he says he receives secret communication through his phone and in his mind. What is the most likely diagnosis? So pause the video here if you want to figure out the answer for yourself. If not, the answer is option D, schizoaffective disorder. This patient is experiencing mania and psychosis. When they are not being treated for mania, they are experiencing psychotic features such as hallucinations. So that means their timeline would look something like this. So based on this timeline that you can see here, the best option would be D, schizoaffective disorder. Now let's look at question 2. A 27-year-old male is brought to the emergency department by his mom because of strange behavior for 3 months. He thinks his mom is trying to kill him. He says he receives messages on the TV that says she put poison in his food. On exam, he makes poor eye contact, and his thoughts are disorganized. What is the most likely diagnosis? A, brief psychotic disorder, B, schizophrenia, C, schizophreniform, or D, schizoaffective disorder. Pause the video here to choose the answer on your own. This question describes a man that is having hallucinations and delusions for 3 months. Since he has been experiencing his symptoms for greater than 1 month but less than 6 months, then the answer is C, schizophreniform. If you want more questions based on the topics discussed in this series, let me know in the comments below. As always, if you like this content, power up the like button, hit subscribe and that notification bell. And to continue learning, click this video right here.